Good morning. And welcome in this morning. I'll just take a moment to get everyone into the Zoom room. Good morning. All right, so thank you for joining us this morning. Very excited to be here for our webinar, Practical Tools for Positive Mental Health. And I'm Kate Landreth. I'm the educational lead with Family Caregivers of BC. And today we have Dr. Lisa Van Bussel as our presenter, and she's a geriatric psychiatrist at St. Joseph's Healthcare in London, Ontario. And that's within the Parkwood Institute with the Geriatric Psychiatry program. And she's also an associate professor with the Division of Geriatric Psychiatry at Western University, also in London, Ontario. And she's presenting today on behalf of the nonprofit organization Fountain of Health. And Fountain of Health is dedicated to sharing the science of brain health and resilience and translating it into practical action. So Lisa, I'll get you to, actually you can bring your video up so people can see who you are, and I'll get you to flip to the next slide. So just a few little notes on the webinar. So very simple this morning. You'll remain muted and your cameras are off, and that happens automatically. And we'll prompt you to reflect. I can see already some messages in the chat box. And good morning. Thank you for joining this morning. You can put your reflections or questions within this chat box, but there's also a Q&A section right at the very bottom of the screen. And you're welcome to put your questions throughout the webinar. We might pause at certain stages to if the question's relevant to the topic, or we might answer them at the end. I'm just checking the chat box. So it's an hour presentation this morning. It's recorded and it will be sent to you after with the link. All right. Also, we're gonna just use a little bit of our interaction, and I'm gonna launch a poll. So on your screen right now, you should be able to see a question. So what is your role, or what's the most applicable role that you're joining in to our webinar this morning? You can click what's most relevant to you. Great, I'm going to end the poll and share the results. So we have, of the 75 attendees, we have primarily caregivers, so 66%, and then people supporting a caregiver, 13%. And we have some social community sector professionals and healthcare professionals. So thank you for joining, and that's helpful for Lisa to know who she's presenting to this morning. Okay, Lisa, I'll let you flip to the next slide. So a moment this morning to acknowledge the land that I'm on and Lisa's on for presenting. So thank you to the Lekwungen speaking people, also known as the Songhees and Esquimalt First Nations. This is where I'm presenting from, where I work and I live and I play. And Lisa is presenting from Western University in London, Ontario, which is located on the traditional lands of the Anishinaabe, Haudenosaunee, Lenape-Wauk, and Attawandaron people. And they're on lands connected with the London Township, and Sombre Treaties of 1796, and The Dish with One Spoon Convent Wampum. So in the chat box, we welcome you to share where you're joining from this morning, and also taking a moment to acknowledge the land that you are on. And I'll get you to flip to the next one just as people are putting in where they're joining from. Welcome, Denise, Darlene. So we have Manitoba and Burnaby, Bellingham and Campbell River. Wonderful. So Family Caregivers of BC, that is who we are. And we're a nonprofit organization that is dedicated to supporting unpaid friend and family caregivers. We have been in service for over 30 years now. And the webinar this morning is part of our educational offering. So another part of our educational offerings that we're really excited about is our podcast, Caregivers Out Loud. We have 10 episodes that we would love for you to listen to, and it can be found on our website. We also have caregiver support in the form of our toll-free caregiver support line and caregiver support groups, and you can find that all on our website. Now I'll hand it over to Lisa.
Well, thank you so much, Kate, for inviting me and acknowledging the Fountain of Health. As Kate mentioned, I'm one of a group of geriatric psychiatrists and others who are really interested in promoting healthy aging. And as mentioned, our focus is really about practical tools for positive mental health. Just to kind of let you know, as a geriatric psychiatrist, I see a lot of older adults with moderate to severe dementia. I see people with late life mood disorders. And a lot of my time and focus is working with their caregivers, sometimes their family care partners, informal caregivers, as well as working in assisted living or long-term care. So I've certainly, over a number of years, have kind of worked with a lot of caregivers in terms of the work that they're doing. So I wanted to acknowledge all of you and the work that you're doing and the people that you're supporting. Also, I've acted as a caregiver myself to family members who've had their own health issues. So I don't know if I'm currently walking in those shoes right now, but I've certainly in the past, and I appreciate all the work that you do and the support that you provide for people in your community. So today we're going to talk about the importance of positive aging and how it's linked to positive mental health. And really we want to promote brain health by modifying 5 key health behaviors and talk about those key health behaviors. And then in the second half of the presentation, really talk about kind of some specifics around how you might be able to kind of start thinking about your own health behaviors, possibly set your own goals, and learn where to find easy to use tools that will help you promote mental health and well-being. Although I'm a geriatric psychiatrist and this is really applicable to anyone, and certainly I think it's really important for all of us to take some time to take care of our mental health and well-being. So just to take a little time for context setting, we know that life expectancy has really increased over the last 100 years, and this graph shows us that. And in particular, it's noted that individuals now have much longer time in their adult life and later adult life. And so it's really important for us to kind of think about what does this mean in terms of people's quality of life as they age. The other thing to think about when we kind of talk about this is really about, what are the factors that have contributed substantively to this increase of life expectancy? And, one thing people ask is, well, is it my genetics? And so what is the percent of longevity linked to genetic inheritable aspects from family members or parents? And when we really look at the accrued data over many years, the extension of life is really primarily due to modifiable factors, because really only about 25% is really due to genetics. And I'm going to show this in a bit of a different way, just for us to kind of get all on the same page. Inherited genes certainly impact our health and our health conditions and how we age, but there are other factors we call epigenetic factors that are really more modifiable or related to environment, outlook, and lifestyle. So if we think back at that first graph about the extension of life over the last 100 years, it's probably due to the modifiable factors such as improved nutrition, hygiene, living conditions, better quality in terms of water that people will use. So we can certainly in our culture here have seen this impact in terms of modifiable factors on life expectancy. So how does this link to the concept of aging and how we're aging linked to positive psychiatry? Because why is a psychiatrist interested in this, you might be asking? Well, I've been working in the area of psychiatry, coming into close to 30 years, and really the concept from positive psychiatry is to shift the thought around we're not just here to relieve symptoms, but to help people thrive, even in the face of illness and disability. And so from a geriatric psychiatry perspective, this means working to promote successful aging through enhancing positive psychological traits like optimism, resilience, and social engagement. So hopefully this kind of makes sense to you. Is like aging is, we're all aging. We're all just different stages of aging. And then really what are the factors that impact our aging and that we can potentially modify or we can at least reflect on. So positive psychiatry certainly wants to be part of this and wants to kind of think about how do we move forward and impact more successful and positive aging. So one of the key things that comes from psychology and psychiatry is the cognitive behavioral model of thinking. And it really comes down to how do our thoughts and behaviors and emotions interact and inform each other. So if we're really taking the concept of kind of an older person or as we age, we might be thinking about, I'm kind of getting ready to retire, for example. Does this mean I'm over the hill? That is all downhill for me. That might be some of the thoughts that somebody may have, and that might contribute to them then having a more sedentary lifestyle. So you can see how the thoughts impact the behavior. So it's really a core part of how kind of positive psychology and psychiatry come together to think about how do we have ways of impacting our health behaviors in particular. So it just reminds us that really our thoughts are very powerful and it can really impact kind of what we do and how we do things. So I'm kind of bringing this image up because we now, are really in a society that often has negative views of aging. And this can be very challenging. You can look at the terms in this slide and bring up a lot of stigma and negative views and stereotypes. So if we go back to our cognitive behavioral frame of how we look at things, maybe we can start to impact the negative views of aging, and maybe this will have some positive impacts in terms of successful aging and impact on our mental health and well-being. And this is really one of the core areas for the Fountain of Health, is to start to help us target our attitudes towards aging and try to shift away from some of these negative attitudes. So here's an image of a fellow, Robert Marchand, who back in 2017 set a world record of bicycling 22 kilometers in an hour. And this was a world record that he set. And really, it was told that he started cycling at the age of 68. And so this is just an example of somebody who possibly used his kind of own goal setting and said, well, I'm going to start doing something in my later life. And it resulted in him achieving something that was quite significant. So just an example of how our thoughts can influence our behaviors. So when we're kind of thinking about this in terms of positive aging and the impact of mental health, one term that often is heard is resilience or resiliency. And resiliency might be the ability to rebound in the face of diversity, because life brings challenges and diversity and stressors. And we all know about stressors. I mean, many of you may have stressors because of some of the support that you're providing. And a reminder, all of us have been living through this past year and COVID and the chronic stress that has probably brought to many of us. So how do we stay psychologically and cognitively resilient in the face of multiple stressors or ongoing chronic stress or losses over a lifetime? So we really might need to think about what are the biological, psychological, and social things that are involved in resilience. How can we assess them and how can we possibly enhance them or modify them? And really the concept is that, you know, there most likely is capacity within all of us to influence and enhance our resilience. Two of the types of factors that could contribute to resilience is cognitive flexibility and optimism. I'm going to define these in a moment, but I'm going to just show you a little picture. This is a little turtle who seems to be on the his back, and he seems to be saying, "Oh my God, I'm flying." Well, you know, that might be a little Pollyanna. I'll use that term, or using rose-colored glasses. You know, optimism and cognitive flexibility aren't necessarily about these things. They're really maybe more about, for example, optimism is probably more about not the rose-colored glasses variety, but the willingness to see beyond problems and look at what's good in ourselves and others, and for what's meaningful, even in very difficult situations. And cognitive flexibility is the ability to focus on what's changeable in a very challenging situation, and the ability to shift away from some of those ruminations or things that might be nagging at us or worrying us about what we can't change, and then stay present in what we can influence and change. So these are some of the key ingredients of resilience or positive thinking. So right, we're here to talk about, you know, how do we influence our mental health and well-being? How does aging impact that? And what we're really seeing is that there may be some things that we could be focusing on that maybe we haven't talked about or focused on in the past. So positive thinking is often correlated with key protective factors such as higher reported happiness, stronger relationships, and problem-solving skills. So again, everyone in life has problems or things that they have to manage. It's about how we manage them, even if the outcome is different than what we expected. It's about developing agency and working on those resilience factors. So the field of positive psychology really kind of tries to bring together that concept of the cognitive flexibility and optimism as some things that we can kind of focus on. So here's a little picture to kind of reframe things again. This was actually a photo I took in the yoga studio I go to pre-COVID. I haven't been back for some time. And I've been going there for a number of years, and I looked at the wall and I noticed something different, and I stopped and I looked and I read it and I said, "Don't believe everything you think." So it was a good reframing that my yoga teacher is constantly trying to help us make sure we're cognitively flexible. And I thought it was another example of how do our thoughts, in fact, influence our behaviors and our emotions. So in kind of moving forward, we're really kind of wanting to think about that along with physical fitness, cognitive and emotional resilience are dynamic capacities that we can grow and influence over time. They're not just simply traits that we're either born with or we don't have. So this is going to really maybe potentially help us to modulate the negative impact of maybe chronic stress or loss, and help really activate kind of more positive kind of neurologic functioning. I'm going to use kind of more technical terms. So coping with stress. So now I'm going to transition again and talk a little bit more about kind of, you know, some of the things that we're really kind of focusing on, right? So how do we build resiliency or resilience in the face of stress? You know, when we have a short-term, you know, time-limited acute stress or crisis, often we'll just kind of work our way through it. We'll muscle through it and kind of figure it out. And we'll kind of hang on, kind of like this guy is. But, you know, often what goes is how we self-manage our own self-care, right? And so when we're kind of starting to think about managing and coping stress, you know, this is okay for short-term approach, but for ongoing challenges or stressors, we might need a different approach, one that brings to the fore proactively self-care and self-management, and really kind of thinking about that. So, right, and here we are in our global context of COVID. You know, this is an ongoing stress for all of us. You know, I think it clearly has affected everyone's lives in some substantive way. This has been a global abrupt loss of normalcy. You know, we've really been knocked off our feet, so to speak, during this pandemic, and it's had substantive impact. You know, I told you about my work life. I used to go to many nursing homes, seeing mainly older adults living there. And I know that this has really impacted them. There's been disruption of people's regular routines and norms, whether you're working or you're retired, whether you're still in school. It really has impacted everyone. So this is really kind of an important part. It's like, okay, we've got ongoing stress. How are we going to kind of move forward? How are we going to kind of look at our response? And some of the old traditional stress responses are like flight response, right? The people may want to, you know, try to flight, you know, take, you know, move away, try to avoid the problem, freeze. You know, they might not respond at all. So there are kind of ongoing stress responses that happen. And we need to kind of think about how we're going to manage and what are the ways we can kind of go back and remind ourselves of the things that will be helpful in maintaining positive mental health. So can we promote our own well-being in the face of stress? And what is our psychological PPE? I mean, everyone knows about PPE now. Everyone knows about wearing masks and using hand sanitizers and physical distancing. But along with it, we need to kind of also be thinking about what are the ways we're going to psychologically kind of support ourselves and each other. And this brings me right back to kind of the concept of the fountain of health. So I want to introduce this a little bit for you. So as a way of us kind of going to, okay, how are we going to move ahead with this and learn a bit more? So the Fountain of Health is a Canadian initiative that was kind of first started in Nova Scotia and Dalhousie University. It's non-for-profit, and it really is looking at translating high quality, excellent science about brain neuroplasticity and resilience to healthcare providers, public like you, as well as developing and promoting good practices around 5 key health behaviors. And we'll talk more about how you can do this. There are free access tools that can be used in clinical practice, or you can use on your own to promote health and to really help us move away beyond an illness-focused process to really about health and well-being. And, you know, they're also supporting age-friendly communities. So the Fountain of Health has really been one structure over 10 years now that have really kind of helped to pull together national resources to do that. And what they've really come to is 5 core areas that will promote optimal health and resilience over a lifespan. So whether you're in your midlife or a younger person or an older person, this could be applicable to you. And they look at the 5 key areas as positive thinking, and really about changing how we think about aging, social activities, so staying socially connected, physical activities, so keeping physically active, brain challenge, which is engaging in lifelong learning, and taking care of our mental health. So the next section, I'm going to talk a little bit more about some of the related science or evidence that the Fountain of Health has pulled together. There may be a section that I'll go through quickly at the end because it's mainly about resources, but I wanted to share with you some of the work that they've been pulling together, obviously from researchers around the world who have been focusing on optimal health and resilience over the lifespan. So the first one is around what correlates with a longer life. Here are the 3 options. It's a question for you to think about. Is it 1, having low weight, low blood pressure, and low cholesterol? 2, or B, being a non-smoker or somebody who exercises? Or 3, thinking you've aged well? You know, so when you think about this, you might think, well, you know, we hear a lot about the importance of blood pressure control and cholesterol and being a non-smoker. But this research from 2002, Levy et al., really said that how you think about aging probably has the most impact on a longer life. So positive self-perceptions of aging usually results in about 7.5 years of extended increased life expectancy. So it's again goes back to that cognitive behavioral model of thinking that has been shown in research in terms of correlation with longer life. The next is positive views of aging with walking. A group of researchers in Germany studied over 4,000 middle-aged and older adults over a 6-year period. And those older adults with a positive view on aging did more regular walking and increased walking over time. Interestingly, older adults with significant health issues walked just as frequently as those without if they held positive views of aging. So certainly we're starting to see research over a number of years talk about some factors that are connected to resilience, cognitive flexibility, and how we see ourselves. Let's talk about physical activity, because I think this is probably one area that you've probably heard a lot about. We probably already know about the benefits of physical activity. So maybe this will be all a reminder to all of you. So physical activity is the best promoter of brain neuroplasticity across the lifespan. All forms of physical activity help, whether it's mild to vigorous, whether it's strength or cardiovascular, and the avoidance of sedentary behaviors. I think there just continues to be more evidence in this domain that continues to accrue. So what would we say is like, well, physical activity and cognition. The more regular activity usually results in improved cognitive function in older adults. So up to 3 times a week for about 60 minutes. Regular physical activity can reduce the risk of dementia up to 30%. So substantive evidence that kind of is accrued. Sedentary behavior and depression. There has been correlated research that shows that sedentary behavior is correlated with increased risk of depression. This is quite substantive, and so it really clearly links, health behaviors and some challenges around mental health and well-being. Physical activity improves mood, and it can often be a factor in treating mild to moderate depression. So this is from the Cochrane Review and Library, which pulls together the substantive research from many areas and best practice guidelines. So it really is showing us that there has been substantive improvement, could be improvement with physical activity and depression. So it's just a picture that reminds us that neuroplasticity, how our brains work and how our brains function, can continue to be impacted over our lifespan by adapting positive health behaviors such as, for example, physical activity. So, and then we talk about brain challenge, one of the other domains. So cognitive activity can promote neuroplasticity. In particular, complex and novel activities are the most helpful. And what we know is higher levels of education usually results in a lower risk of having cognitive disorders like dementia. This was published a number of years ago through JAMA, which is a well-known medical journal that's reviewed across the globe. And they did a review edition about ways to reduce risk of dementia. And they talked about lifestyles, healthcare, and mental and social well-being activities. And you can see in this that the connection around cognitive impairment is significantly connected to some of those lifestyle, those epigenetic factors, exercise, healthy diets, sleep, avoidance of substances like smoking, and good health care, as well as mental health and social well-being activities, such as staying curious, learning new things, and staying socially engaged. So that is, again, connected to one of the other domains. So you can see the domains are connected to each other. The next one is around attachment, social contact, and resilience. And we know that social connectedness is a basic human need. We're all experiencing that need and craving for that right now during COVID. and it heavily influences brain health and resilience. And is when we are able to do it, it usually lowers the risk of dementia. So finding ways to continue to build and rebuild social connections and attachment relationships across your lifespan is critical to healthy aging. This is a huge societal challenge right now with what's happened in our world, and how to stay connected as part of a normal aging in our kind of current culture, in which seniors, again, older adults are often segregated, or there's certainly a bias against aging. So social connection is really important. And we know Robert Waldinger, who did some landmark research and followed a cohort of men aging over many years, that at the age of 50, secure relationships were the single most predictive variable related to well-being over 25 years, regardless of background. So evidence is there. And the finals, we know that loneliness and social isolation has a significant impact on health and morbidity. In particular, for example, smoking, obesity. Socially isolated older adults also have higher rates of illness, such as infections, cognitive decline, and depression. So social connections matter, and having someone in your corner is important, and having somebody at your back is also important. But, the other thing is that these things can be developed, and we can talk about that when we get to the section on the Fountain of Health tools. So a little bit of cognitive behavioral reframing. It's not about whether the glass is half empty or full. That's not the point always. The glass is refillable. So trying to look for other perspectives. And this is really about cognitively shifting to positivism from a disease paradigm. So again, this is another one of the domains around how do we have more positive thinking around our health and well-being. So rather than having a negative thinking about preventing disease and illness, is trying to flip that to think about feeling good and enjoying life more, rather than thinking about reducing sedentary behavior and depression and dementia risk factors, which sounds very medical-ese, to go out and have fun, trying to find time to walk or move about, find some time in nature, keep up with your children or your friends or your social network. So these are just other examples of how we can start to think about shifting our thinking, and how do we kind of move from kind of looking at this from more of a medical requirement.
Lisa, I just have one question that just came into the the chat box, and it's from Vivian, and she had just to go back to that age 50. I think the Harvard study. And just if you could explain that just one more time, because she couldn't read the slide.
Oh, okay. Okay, let me just go back. I have my speaker's notes too here. So Robert Waldinger, he is done a substantive study in Harvard, and he also has done TED Talks. So if others are really interested in learning more about him, certainly I would encourage you to check out TED Talks if that's something of interest of you. So what he did is he had a group of two groups of Harvard sophomores and young adults from different areas of Boston, and often some of them from the poorest areas of Boston. This is dating back to many, many years ago. And what he did is he followed this cohort of men in particular. So it is certainly mainly focused on young men. And what he did is he followed those men over 25 years, and regardless of socioeconomic background, those that had secure relationships were it was identified that was the single most productive variable related to the sense of well-being as they started to go into later life. So they tried to control for a number of factors, and that was significant. He still follows this cohort, I think, who are getting quite elderly. So certainly I would encourage others to kind of seek out references on him. And again, he's spoken in TED Talks, so free access if you're interested.
That's great. Yeah, that connects to that domain of social connection. Thank you.
Yes, very much. So, oops, I'm just going to move ahead because we're getting just past 1:30. So again, this is really about cognitive shifting. We talked about that. The other area that you might be hearing about more, which helps us focus on our cognition and our thoughts and positive thinking, is shifting to a culture of gratitude and self-compassion. So gratitude might be appreciation of what's valuable and meaning to oneself, and a general state of thankfulness or appreciation. Certainly, this has gained some recent, interest. And Kristen Neff, who's cited at the bottom of this slide, has a great website that you can go to for other free access resources, and really encouraging people to start to kind of work on developing the capacity for gratitudes, such as writing a gratitude letter, keeping a journal, counting blessings, and working on self-compassion, which is kind self-talk, speaking to yourself as though you were your own best friend. So really trying to kind of be mindful, take some time to do that work. So here are some examples that might be related to gratitude or self-compassion. I'm not going to read through all of them. There's a lot on this slide, but I'm going to take a moment to pause at the one slide, regularly setting aside time to recall moments of gratitude. During COVID, this has been hard for me. There's been a lot of challenges working in healthcare, and I suspect also in British Columbia. I came home several times really tired and a little bit demoralized, I must say, because of what was going on and not feeling I could have impact or control what was happening. And I noticed I was getting very grumpy, and I'm at home with my husband and one of my 20-year-old children. And they're like, okay, what's going on? And so I said, okay, this is dinner time. Why don't we start each dinner or end each dinner with a gratitude roundtable? And they both stopped and looked at me and they went, what? And we worked on it, and it really did help us shift our end of day and our sharing together. So I'm just kind of shouting out to that one in particular. You may already have been doing that over the years, but it does take some work, and it does work, and people will shift with you once it starts happening. So here are some other resources. I'm sure that it sounds like Kate has talked and has supported many of you around other strategies to help work on your mental health and well-being. I'm not going to go into these detail. A lot of it's about mindfulness, relaxation techniques, sleep hygiene. There are many resources available, free access resources around sleep and brain health, as well as nutrition and brain health. And here are some other more Canadian mental health e-resources that we've added, which will be links that will be sent out to Kate and sent out to all of you. So I'm going to shift now finally to the Fountain of Health and more about some of the tools that are available to you. And here's the web link, and it's free access. And if you just search it, if you have a browser, you can search Fountain of Health. You can do that after the talk. I'm going to take you through some of the resources and some of the work that's been happening to help actually actualize some of the things that we've just talked about. We've talked about cognitive behavioral models of thinking. And so these resources really help anyone who wants to use them start to break things down and really focus on, how they're feeling about their health, and then help them start to goal set and make change. So this is an example of one of the tools. We have a health and resilience questionnaire. This is a very busy slide, so I'm going to break it down in some smaller slides or easier to read slides. This is a questionnaire that's being used to help people really start to think about their health and resilience and see how they self-rate their health and well-being in those domains that we just discussed. So here's an easier slide. How do you rate yourself in terms of being socially connected to others on a scale of 1 to 10? How would you rate yourself in terms of being interested in learning new things on a scale of 1 to 10? Using your own definition, how would you rate yourself in terms of successful aging? And finally, how would you rate yourself in terms of how likely you are to seek mental health if you needed it? And then how would you rate yourself in terms of being physically active? So The slide I just showed you is a paper example of what's being used when we're in pilot stage of this project. But if you do take some time to get into the website for Fountain of Health, you'll see that there'll be a questionnaire that you can use if you sign up to the app. And I'll show that to you in a few minutes. Because really what we're doing is we're trying to have people think about and reflect on their 5 areas of healthy aging, and then think of areas where they can maybe make some change or set some goals that might allow them to evaluate whether they can work on that or not. And these are the 5 areas we just talked about: positive thinking, social activity, physical activity, brain challenge, and mental health. So, and what we try to do within the Fountain of Health is help you develop SMART goals, which are concrete goals that will help you move forward. And they need to be specific, measurable, action-oriented, realistic, and time-limited. And that's where the website comes in a few minutes. And we want to look at how realistic is this goal for you to do in the next few weeks? When is the last time you did the activity? How confident you'll be to accomplish this goal? And what are the times of day or week that's feasible for this goal? And what are some of the barriers you expect you'll face? And how likely will you do it? So these are questions to help you really refine goal setting when you work through goal setting around some of those domains. So here are some examples of SMART goals that you might be thinking about around physical activity. Very simple, depending on your ability. It may be going to the mailbox 3 times a week for a week. It may be getting up during the ads or a break from watching television. It may be calling up a family friend that you haven't called in the past once a week, or setting up a coffee date over the phone. Or a brain challenge might be reading something different that you haven't read before, such as the newspaper, listening to a radio program. And mental health and positive thinking might be around writing a gratitude journal twice a week for several weeks. So let's take a look at what this might look like for you if you're going to log in. I've mentioned the website. It's thefountainofhealth.ca, and it will be connected to the wellness app. And this is what you'll usually see in the when you log or you find the website. And you can log in, and there's an area for the wellness app. And once you sign up, you can get access to the resilience questionnaire. There'll be SMART goal setting tools, readiness assessment using red, yellow, and green light responses. There'll be daily encouragement, daily check-in calendar, and useful links on resources, everything from insomnia or sleep difficulties, stress management, meditation, nutrition, TED Talks, videos on optimal aging. There's a lot of resources on the website, and in particular, if you sign into the wellness app. So this would be kind of what the wellness app would look like once you've signed in. You'll have your profile and a goal and a daily check-in calendar. And there's the 5 wellness areas, encouragement resources. So it's all there, easy to use. I showed you the questionnaire before that was more paper-based. Here on the other side, you can see the colors highlighting the similar questionnaire that's on the app. And you can use this as well. And you can just kind of toggle along in terms of where you see yourself. Like, how physically active are you? This person might say, they're very physically active. They're close to 8. Those are just examples of how that will look on the website. Next, it will invite you to make a small health behavior change in one area. Usually the top 3 areas are physical activity, social activity, or brain challenge. Of course, there are others around positive thinking and mental health, but it's seen that often these are the ones that are easier to start with. And then that goal would be a part of the app and invite you to look at your long-term wellness and start to make some of those changes. So I'm going to just go to the next one. So this would be an example of how it would look on paper on the one side, and here it would be physical activity, staying physically active. And here are some exercise ideas that the person may use.
Lisa, I just had I
Yeah.
have a few questions, but I'll wait. But this one I think is relevant. The cost, is there any cost associated with the wellness app? It's free,
It's free access. You can use the website. There's many resources on the website that can be used. And there is one link I can show you as well in real time how it looks if there's a moment at the end, Kate.
Great.
So there is no cost associated with this. And I think I saw it has this resilience scale being validated. So I'll talk about the research with this at the end. I see a question about that. So just to show you a few more things that have come from the website. Here would be another view that you might see, a daily check-in and goal tracking calendar. And it said, are you ready to work on your goal today? Ready, maybe, not ready, I did it. So you can kind of just click on how you're doing. And then there's a calendar in terms of, for example, for this person was doing exercise, the upper body 3 times a week. And there are kind of icons to show what they've been able to do. So, and then there's encouragement section with audio supports. People might find that really interesting. It may help them also listen and reflect on what they're working on. And then you can track progress and goal follow-up at 4 weeks and consider barriers to change and repeat. And we know that, you know, part of this is actually the work really is about goal setting, problem solving, adjusting and continuing to work and having a sense of agency. And then you can look at your progress over several weeks, depending on the areas that you're focusing on. So what are some of the barriers that have been noted, right? So some of the barriers that have been noted with this work has been by clinicians. So if a clinician is supporting someone working on this, like a healthcare provider, often the clinician says, well, I don't really have time or I don't have the training. But probably the top concern is that they report that they don't have the time to do these things. Other barriers for health promotion or self-care by the individual or their person or the patient. Again, here are some options. People might think that they're too busy, stressed, or sick to do anything. It's not relevant. They don't have enough. It's too late for them. It won't make a difference. The goal is too small to matter. Most people who are having some barriers are often feeling too busy or stressed with regards to starting, essentially. So this is just something to kind of keep in mind, that people often have barriers to setting goals. And I think what they've tried to do is use fairly simple tools that are free access and follow up with people on a regular basis. So how does this work? Well, this has been tested in 3 clinical trials, 3 clinical trial phases with over 500 people. And goal attainment over 4 and 8 week periods have been shown to have an average of 80% of patients who use the Fountain of Health tools to set a goal are at least partially or completely able to exceed their health goal that they set in one of the key areas. So it might not directly answer one of the questions around the validation, but certainly there is research happening around the ability for people to use the tools and to complete or partially complete the goals that were set for them. And the results are fairly close on whether people are using paper-based tools, which the first pilot was mainly paper-based, or whether people are using the wellness app, which is more virtual or electronic-based tools. So when we notice that the majority of people are setting their goals in the domain of physical activity, social activity, and then brain challenge, which is, I think, what was anticipated going into the project as well. So as we're coming to the end, I think as a reminder that often one meaningful change matters over time. that it may feel like there's not substantive change is going to happen, but this analogy around 1 degree effect is important to think about. So the 1 degree effect is, if you think about a plane that's on a flight path, if you change its path by 1 degree, it might have substantive impact over time. So could be similar around making one small change around one of those core areas around your health. It could make a substantive impact over time. So that really is one of the key messages we're trying to achieve, is these are small, meaningful changes over time, and trying to have people have access to tools and resources that will help them maximize their health and well-being as they age, and to ensure that they have some supports and resources available to them. All the resources I showed in the last few minutes certainly can be used by healthcare providers or social service agencies and workers with their clients. Certainly, it's free access for anyone to use. And it really focuses on those 5 key areas that we talked about at the beginning, and helping people shift to a more resilient thinking pattern around how they manage their own health behaviors. So I'm going to flip it over to this slide. I think, Kate, right?
Yeah, that's great.
I know we had a few questions, but I'll stop there.
I'll jump into the questions. We'll leave our FCBC resources there just so people can see and note if really it's all on our website. And I think some of these questions are great. So I had one from Annette. It was a little while ago, but she had just asked if there was any evidence-based practices on side-by-side activities for people with dementia and their family caregivers that would promote more mental health for both parties. And she just said, doing things together seems obvious, but where could one look in the evidence base for the kinds of activities that are more scalable, enough to accommodate the capacity of both the family caregiver and the person with dementia? I don't know if you have specific examples of that, and that's a great question. I had put just to Annette, because I know she's looking for evidence-based, but we did have Wendy just present yesterday on our Facebook Live. I put in the Facebook page, and she spoke specifically to this as her role of going in and supporting people specifically with dementia and meeting them where they're at. But I understand your question is more around engagement for both parties. Lisa, if you have anything or any insight there.
It's such a great question. I actually want to bring it back to a couple of my colleagues locally and to the group who are looking at literature, because, intuitively, I would say anything that engages people in social interaction and physical activity is often seen as, a double gain, right? We often think of like ballroom dancing has been discussed as complex physical activity, requires cognitive, and you're socially engaging. I know it's a different dyad of people, but certainly I would want to kind of follow up on that. But I don't have it at my fingertips today in terms of whether there's evidence-based. What I see, though, for older people with dementia is that we certainly know that if they're engaged with physical activity, that certainly will help them in terms of their overall health and well-being. So certainly I think that there is evidence to speak to that. But thank you for the good question. And I actually want to go to some of my colleagues who run day programs in the area who are very interested in how to support social and physical activity for people with dementia.
That's great. I also had another question, and this is back when you had your survey slide up, and just a question around what would you consider to be successful aging per that survey slide?
So so you mean the questionnaire slide? Is that?
Yeah. Like, is there a marker or?
I think it's actually, we want to make sure people are working towards their own goals, right? To say that what I define as successful aging may be different from, say, what you define, Kate. So, I think we used a scale that would allow people to see if there was change or improvement in one area. Some people may say they're physically very active, but they really have not expanded their or changed their social network, or feel that they may be more isolated than they realized. So that person may want to focus on that goal. So I think it's more of a dynamic. It's not like this is a mark and then you're good to go. It's more about a constant work and evolution of kind of trying to focus on that cognitive flexibility around how you see yourself, and a process of improvement.
And that was one thing I wrote down when you had shared that how you think about aging, and that positive self-perception of aging and how it actually affects the longevity of your life, I think is so impactful just to hear that. So it is really a personal journey. And so I appreciate that. We also have a question. This is just a question around the resources, and someone that participates in a senior social group, and wondering if there are more people within Fountain of Health that do supports to get people that maybe are not as familiar with the app, to help them get going on that, or if it's pretty self-directed.
I realized I stopped screen share, Kate, but that's actually quite interesting, because there have been some trials, I think mainly in Ontario and in Nova Scotia, where there are facilitated groups around this, I think peer facilitation, possibly through senior centers or for certain groups, where they are really focusing on using some of the tools that have been informed through Fountain of Health, and helping to kind of share and help work together on this, right? So we know that some people may uptake this and do this individually, and that's great. But we also know that some people need some coaching. Hey, I've been through COVID. I need to have coaching at times. I don't know about you, Kate. So this is why the tools are very flexible. Healthcare providers can use it with a patient or a client or service sector. Certainly you can bring it to your healthcare provider and say, I want to work through this. Can you use some of these tools that are really informed around health behaviors? And there has been work around more group formats to do that. So I hope that answers the question, because I think if there's interest, certainly, please go through the website, because there are lots of different resources, and you might notice some that are developed specifically for groups. And please pull them and use them, right? That's why they're there. I'm just saying, free access for all, right?
That's great. And I know Janet McLean, she's our colleague, she had mentioned in Victoria, if you're in BC, in Victoria, there is a group called Voices in Motion Choir for people with dementia and their caregivers. So that's a great activity that, mutual benefit of both of the caregiver and their care recipient.
Oh, we have those in London, Ontario is a big choir city. You just got me going, Kate. We have something very similar here in London. It's called an intergenerational choir. They have people living with dementia with a local high school is a very strong music program, and they've had them and their family members participate in choir for social engagement. So it's on pause, obviously, during COVID. So yeah, it's a great example.
That's great. Also, if you'll click to the next one, we also have in BC, it's called Here to Help Resources. And this is for people with mental health and substance use information. So that is also just something we wanted to put up. There is an interesting question, and I'm curious to know, in terms of people that have a spiritual activity or connection, what domain do you think that would fall in, or would that be a separate domain in terms of, I think it's a really interesting thing, because I was thinking about that too. I know you brought up in mindfulness and that connectivity, and then the community, kind of that social connection. But I wonder if there's ever been consideration around that domain, or maybe something it is already included.
Well, that's interesting, Kate. It's always when things kind of coalesce at the same time. Here in London, we recently had one of our psychologists who's almost done training, Serena Wong, work with Ken Pergament, who is out of Bowler Green in the US, who is a lead in spiritual struggles in older adults, and the importance of identifying that I certainly think that that is connected to the positive thinking and mental health and well-being area of the 5 domains or core areas. And then when I look at one of the slides, I don't know, I went through it fairly quickly, the 5 happiness interventions. The last one was savoring positive experiences. When I've spoken with Serena and she worked with our group around some education and training, she reframed it as savoring or reflecting on sacred moments in a very mindful way and using mindful techniques to do that. So I certainly think that there's a connection to this work. It may not have been pulled out as a separate domain, so I really appreciate the comment, but I do feel that there's a connection to some of the other areas. And I do feel that from a mental health and well-being, how we work around spirituality is going to move ahead and be one of the core areas around our work together. So cognitive behavioral models of thinking are certainly very important, but there is certainly more advancements around acceptance types of comments, accepting our vulnerability, and also working through some of the spiritual struggles. Sorry, Kate, you got me going.
No,
I've never answered that one.
I'm
But
happy
I
that,
think
thanks
really
Louise for
good response. Really good for the group to be thinking about that. And maybe some of these interventions can be adjusted really to be focused on more that spiritual aspect.
And Annette is, as someone, she's interested in Ken's specific spelling of his name, just because she's writing a paper on spirituality at UBC. So do you by chance know? And maybe I can follow up with Annette separately. If you have it, that'd be great.
I put it to the panelists. I don't know if it went to I put it in the chat, but it might not have gone to all the attendees.
I'll send it out. Perfect. I see it.
We had such an overwhelming response to our education morning when he came. We had people who'd never attended because he's seen as a bit of a rock star in this area. So so I encourage you to reach out to him. He may actually, he's retired, but he's got a lot of resilience. So I'm, know he's out there supporting and wanting to keep this conversation going. So yeah.
That's great. And I have just one more in terms of just being mindful of time, but if you have any advice, and this is something that we're always cognizant of too, for reaching seniors who are not always digitally or technology connected. So, people that can't connect to this webinar, let's say, does Fountain of Health have strategies that you can share in terms of connecting in old-fashioned ways of
Yeah. Well, certainly the tools that were developed were paper-based tools. So if you have a social service agency, a family member who wants to certainly reach out, there are paper-based tools and they will send those to you. So it may not be as easy for that individual, right? But I think you could certainly request a lot of the tools around the questionnaire, the goal setting, the reevaluation. The bigger question around that, I think it had moved primarily to a digital domain with the recent projects, Kate. That being said, there are paper-based tools, and I have them all in my office sitting here as well. So I think that the group out of Fountain of Health, and I think Daria would be the person we could reach out to, may be able to direct that person to how to get access to them if it's not obvious on the website.
That's great. So, yeah.
So if you that seem to, I think, to start off with, I think that this is a bigger question that we struggle with the work I do. We know that we're leaving behind a certain group of older adults who aren't digitally connected, and I really appreciate that concern because it has been, in particular during COVID, quite concerning that we aren't able to connect with a certain group of older adults who may be more isolated because of that issue.
Thank you for that. Yes, we are constantly looking at ways to connect, rural, remote areas as well. So if you do have a care recipient that would benefit from the paper, you can always just be in contact with me, and I can forward to Daria and do that connection. Also, I just put into the chat box, you'll get this also as a follow-up email with our resources. So you'll get a copy of the webinar recording and of our PowerPoint slides, and any other additional resources. So for example, the Fountain of Health Toolkit, and where the link is on the website. Also, we have our survey, and this is really important for family caregivers because we would like to hear from you and your experience this morning. And it also helps me program our webinars and educational material that are best suited for you. What do you need right now? So I'd love to hear feedback, and lots of positive thank yous, Lisa, for sharing your knowledge and expertise this morning and this great tool. Thank you. So I know we've gone 5 minutes over, and so I just want to say thank you again. And again, the resources will be sent out for you to follow up. And if you have additional questions that you would like to ask myself or Lisa or the team at Fountain of Health, you can always be in contact via their website or via me. All right. Lots of thank yous. Oh, people, this is great. Yeah, they love the wellness app. Wonderful.
That's great. And they'll start to send you little emails once you sign up. So it's really good. And we, I think they also just really are trying to continue to bring new information. So there's becoming a new focus on diet in particular, and wellness is another area that they're really starting to dive into. So I'm hoping that they'll have more resources on that area. And I will bring spirituality because I've been tracking that one. So
that's great.
So it's great.
Wonderful. Well, thank you, Lisa. Have a wonderful rest of your Friday afternoon in London. And until we are back on Zoom with another webinar, we'll see you again. So thank you. And in terms of mindfulness, if you are interested, I offer mindfulness once a month. We have tons of resources of mindfulness on our family caregivers website. And so if that is something that you're interested in, come and join me. I'd love to have some people come and sit and be mindful together. So thank you for that. All right, logging off. Thank you. Bye.